Unstable Vitals is the podcast that takes the pulse of American healthcare, and the prognosis is critical. Dr. Adam Brown and Dr. Lara Zibners, physicians turned entrepreneurs and business leaders, expose why the system is unraveling before our eyes.
And welcome to yet another wild and fun episode of Unstable Vitals, where healthcare is unstable, and so is Adam, my good
So is
friend.
Laura.
I'm Dr. Lara Zibners. I'm here with Adam Brown, Dr. Adam Brown. What you doing today, Adam?
I don't know. It's hot in London. Like, it's Washington, D.C. swampy hot. Like, for the London listeners, it's like 36 degrees.
Well, but what people don't understand is that air conditioning is so like Brits are above that. So everybody over here is now scrambling, and I've heard that nobody can get one in England.
Oh, I did.
They
Wait,
finally realized the error of their ways.
Yes, but so being a Southerner from North Carolina and knowing the importance of aircon, as they call it here, of air conditioner, I tried to look for one when I saw in May that it may hit 30 degrees or AKA in the 80s. Because I'm like, I can't handle that. I can't handle that. So the only place that I found an air conditioner, I'll show you. I'll show the listeners. It is from an RV company in Spain.
You've got that fixed in that window with some zip ties, don't you?
I do. I have a zip tie tying that thing together to the windowsill. And let me tell you, my 68 degrees office is an absolute delight. And I've had friends and teammates that have come over when I've not been here and said, can I just use your office? And the answer is sure, for a fee. You know, no, of course I let them over, but it's a real thing. There's these places don't have air conditioning. They're built for retaining heat.
Because Europeans don't need aircon. That's it's bad for the planet and the listed buildings. Whereas if you have a country that was literally slapped together like 250 years ago, we don't care.
Exactly.
Anyway, so we've got a great guest today. I think we can stop talking about your air conditioning. She's a real dumbass. She went to Princeton and then Harvard Medical School.
And Cambridge.
And she's got like a master's in pharmacology and like a Fulbright scholar. I mean, yeah, smarter than us anyway. Anyway, so I am on Substack, as everyone knows, and I decided that was going to be my place where I was going to land. And so I started really going around looking at other people's Substacks, finding ones that I could follow that I wanted to follow. And I became friends with this person via Substack. We're internet friends. And it is Dr. Lucy McBride, internal medicine doc and author of Beyond the Prescription. And she is here with us today. And I'm so excited we're meeting for the first time live. Yay.
I'm so excited
thrilled to be here. Thank you guys
so
so much. I'm thrilled to be here. And I've got to show the book.
Show me the book.
Yes.
I've already read it. I got to be one of the BYP ambassador people, so I got to pre-read.
Oh, yes. Yes, you got to pre-read.
Mm-hmm.
Thank you for that. That's amazing.
Yeah, I need to read it. I need to take a look. I'm very excited because, I mean, a lot of the things that I'm seeing that you're talking about and know that you've talked about in your newsletter and things online have been about some of the issues that we discuss, how broken the system is. And,
absolutely.
And so definitely want to dig into it. I know Laura's got the first question, though, so I'm not going to steal the thunder.
Well, I want to hear where this came from, but I just want to say my first impression when I read it was, oh, we're bringing back the art of medicine, are we? Is that what we're doing here? We're we're going to get away from the Burger King model of have it your way when you want it, like, you know, lettuce or no lettuce. And we're getting away from the patriarchal. This is about like the art. So with that, Lucy, where did it come from, and tell us all about it?
So thank you guys for having me. I am a primary care doctor in Washington, D.C. I've been caring for patients for over 25 years. And over the course of my career, I've realized that medicine is transactional. It is impersonal. And when people don't feel well and they can't get into their primary care doctor, what do? They go on the internet, they go on Claude, they go on ChatGPT, and patients deserve better than to choose between a 15-minute transactional appointment and a wellness influencer selling the illusion of control or the illusion of certainty without accountability. So I wanted to write a book that isn't a do as I say book. It's a here's how to think book. Here's how to think about your health in a broader way. Here's how to ask yourself a set of questions that probe your interiority, all the data you have in your body and mind, to really reconceptualize health as more than just a set of lab tests. And then to bring a more kind of full and honest rendering of yourself to your physician, who only has 15 minutes, but you can squeeze the juice out of that 15 minutes if you're radically self-aware and if you know what questions to ask yourself first.
Yeah,
Adam, are you radically self-aware, buddy?
I mean, I think I am. I'm pretty. I mean, I don't know. But I'm not a great patient. I think I'm a good physician, but I'm not the best patient.
Oh, I'm a terrible patient, Adam. I'm a terrible patient. I talk about in the book. I talk about the patient personality, which is knowing thyself as part of being an effective patient. And we all have different patient personalities. It's like the version of yourself that shows up when you're vulnerable and sitting in the exam room waiting for the doctor to come in. And
I like that because I'm a pleaser. I want
So,
everyone to like me, so I'll be like, "Oh yeah, no, I don't drink any wine at all," and
that's right.
No, she doesn't.
No,
never,
except for the kind in the bottle
and the one that sparkles
and the box.
That's right. So yeah, there's the people pleaser patient who thinks to themselves, if only I can get my doctor to like me, everything's going to be okay. Or the internet warrior who's up all night Googling their symptoms and convincing themselves they have, all these different dreadful diseases when what they really need is, just
a good night's sleep,
a day off work or something like that.
Yeah. You brought up something though about teaching people how to think. Now, I was a COVID lead for a big national healthcare organization like yourself on television, talking about like COVID and some of the challenges there. And of course we were facing, and still as evidence was what's happened in the Senate last week, we still are facing a lot of challenges within misinformation around vaccines and COVID, et cetera. But you mentioned something that I think is so critical. It's teaching us how to think about our health, how to think about how to understand information. I mean, I'll be honest, there are, I'm scrolling through TikTok or scrolling through Twitter or X now, or Reels. And it's it's hard to assess, like, was this video real? Is this news story real? What is fact? What is fiction? And so you can imagine how for patients in the healthcare setting, especially if there's preconceived knowledge, which we all have, if there's biases, that we can totally be lulled into thinking one thing or another, and it's dangerous. So tell me more about how you are teaching people not only how to think about themselves, but to think about how they should assimilate and understand information.
Well, so I walk people through this 5-step process in the book where, it doesn't have to be a linear process for you, but there are 5 kind of tenets of becoming a more empowered patient, becoming your most effective version of yourself. By the way, this is not to suggest, do-it-yourself medicine, DIY, be your own doctor. The solution isn't to be your own doctor.
There's no diagrams of like, here's how to attach your leg back on. Just
right. Here's how to do your own appendectomy. Here's some just get a kitchen knife and no. And the first step is understand what your goals are. So if you're reading a TikTok or a clip, or you're reading an article online, like a panic headline, the first thing you want to ask yourself is, does this apply to me? Like, what are my goals? If you are, everybody has different goals, right? You may be trying to lose weight. You may be trying to be less anxious. You may be trying to get better control over your, cardiovascular health, or your, get updated with your cancer screenings. So center your goals so that you're not a victim of information overload and over-indexing on something that doesn't apply to you. But to get more granular on the information that we're all being inundated with and who to believe, I mean, I think that's the problem, right? We live in this era of everyone's an expert. And so I think you need to understand that the big wellness is, a big industry, and that, medical headlines and the major news networks get clicks and likes from scaring the pants off you. So you need to contextualize headlines. You need to understand that the word associated with and linked to are doing a lot of heavy lifting in some of these headlines, right? So linked to or associated with doesn't mean, the carrots caused the cancer. It may mean that the carrots were being consumed by the person who developed cancer and they are totally unrelated.
There's a funny meme about causation and correlation that I go back to, and it's the mockingbird sitting on a bent piece of very thick steel, and they're all sitting on the bent piece of steel. And if you
Yes.
look at it, it's like, whoa, those are some very strong, heavy mockingbirds. That would be the causal thing.
There you go.
We know that's not true, or it's just this happens to be correlated.
This happens to be correlated. Exactly.
There's more shark bites in the summer, and people eat more ice cream in the summer. But sharks.
Therefore, ice cream causes shark bites.
That's
right.
Exactly
right. That's what you might conclude. And I think you also need to realize, like, I think you have to ask yourself when you're reading panic headlines or you're listening to an influencer on Instagram, is this person who's writing about this or speaking about this topic credentialed in the thing that they are talking about? Look, I'm the first to admit that credentials aren't everything. You can have the best resume in the world and be a pretty terrible physician or provider or nutritionist or therapist. But I think we live in a world where people are sort of lived experience is a proxy for expertise. Like if you had a hip injury, then all of a sudden you're a hip, expert and you can help everybody with hip problems. You had you lost weight, so then all of a sudden you're a nutritionist. And I think those experiences matter, but when you're listening to someone for their expertise, you want to make sure, ask yourself, what are they selling? What is their incentive? Because I have no incentive for you to buy my book at all. Like, there's no reason for you to buy. No, I'm kidding. I'm teasing. But I'm not selling the McBride vitamin pack. I'm not selling you something that is just for my profit. And then ask yourself, is this person someone I would trust in general? Do they have the humility? Is this person someone you trust in general? Do they have the humility to say, I don't know, when they don't know something? Do they say, here's the limitations of my knowledge, but let me tell you what I do know, those kinds of things.
It's something I talk a lot and write a lot about, is the difference. People don't understand the difference between health, which is total well-being, and wellness, which is the pursuit of health. And one is defined and objective, and one is a marketer's dream. And it's
a marketer's
celebrity
dream.
Endorsed.
That's right.
And investors like it because it's fast and it makes lots of money. Chakra mats cost way more than broccoli.
That's right. And big wellness is capitalizing on your fear, your vulnerability, and the fact that you don't feel well. Now, I don't blame anybody for turning to the wellness industry for advice. When your doctor can't see you for 3 weeks and you don't feel well, and then you get into that doctor's appointment and she interrupts you in 11 seconds, which is the data shows that we interrupt patients in 11 seconds. Of course, you're going to go on ChatGPT. Of course, you're going to look for advice through the wellness industry. And the wellness industry isn't all bad, right? Like, I believe in yoga and mindfulness, and I think kale can be delicious when it's like, you
not
can
from a
massage
buffet.
it. You can't just put it in a bowl. You have to really,
you have to massage it,
get in there.
Right. But you can have kale and meditate and you still get cancer, right? You can check all the boxes and optimize your protein intake and cold water plunge and still have cardiovascular disease. So I'm a big believer in the both and, right? You need medical guides to help you contextualize your data. And if you don't feel well, go to the wellness industry, but be suspicious of anybody who's selling you the illusion of control, and be suspicious of anybody who suggests that optimizing is, the end all be all, and that willpower guarantees outcomes, right? That personal responsibility right? So I have a patient who for years was refusing to take a statin. I understand that because you read online that statins, do all these horrible things. But the evidence shows that when you have coronary artery disease, your LDL cholesterol should be under 100, and that statins have benefits on the vascular tree in general. He couldn't believe that he had coronary disease. This is not a delusional person, but he was an exerciser, a healthy eater. He's like, I'm not my dad who had heart disease because he smoked cigarettes. So this was someone who was trying to kind of optimize their way out of having a genetic predisposition to disease. Yes, you need to exercise, but I don't want you to, run your knees ragged trying to outrun your genetic predisposition to disease. So it's both and, right? You need trusted medical guides, and you need to be doing what you can to be healthy without perfectionism and without being delusional.
I want to go something serious. I mean, that is a serious thing. I want to talk though. I want to go back to.
You don't want to take cardiac heart disease as just like a casual.
No, I want to talk some stuff though about like want to go back to something. Otherwise, we're going to go down our ADHD, which we both have, rabbit trail.
No
I want to try to get us back to something. And not you, Lucy. I'm talking about me and Lara.
Oh, I've got ADHD, so throw me in the mix.
Okay, so I wanted to go back to something about the wellness industry and tie it to something that may be a little bit surprising for folks. I'm actually going to say something about payers in the positive. Okay, so that's going to be a shock, right? So Medicare and Medicaid, as well as private payers, they go through a very extensive process of determining, is there evidence that shows health economic value or the outcomes are there of whether or not they are going to pay for something. And there is a bit of a signal that if a lot of things that are out there on the market right now that are, yes, they could be brand new pharmaceuticals that could be, promising the absolute world and convert, great grandmother's dementia or things like that. They're probably not going to pay for that because the health economics may not be there, or there may be harm. And we saw that happen a few years ago. But the same thing with wellness type of activities. And that is that these companies oftentimes would love an insurance program to be able to pay for their activity or pay for their product or their service or their vitamin or what have you, and they won't. And the reason why the insurance companies won't is not just because they're stingy. It's because there's not the evidence, scientific evidence that is there to support either the government paying for it through Medicare, Medicaid, or private payers saying like, hey, this juice is worth the squeeze. And so there's a signal there. So to your point earlier about the economics, is that the economics, the clickbaity economics, the perception that you're being given control or that the world is going to be promised to you if you do more crunches with this kind of Suzanne Summers machine, like that is not necessarily, we know who she is, but like those are not going to be the things that are going to necessarily win the day. And the payers have kind of recognized that. And so that was point one. The second thing that I wanted to go back to you is you talked about sometimes patients, they see doctors and are misinformed to think we are making tons of money off of prescribing them things. Can you talk a little bit more about that statin and how we are?
It's fascinating. There's conspiracy theory that physicians are profiting off of people's illness. So it's so interesting because, and I think I understand why that belief is there. But we are victims of the broken medical system, just like patients are. I'm not trying to plead, I'm not trying to have people get out their violins for doctors. We generally are like educated and live in, stable housing, et cetera, and make a living. But this notion that we are in bed with, big pharma and just, prescriptions are like doing, padding up the wallet, our wallets is ridiculous. I understand why people think that though. When a doctor doesn't have time and we default to writing a prescription or writing a referral because we don't have time to understand the whole person, the why, maybe you don't need Lipitor, you just need help with stress management and that kind of stress eating at night to take the edge off of your long workday or whatever. And maybe you need, counseling to help with, anxiety or maybe you need just sort of like a very detailed, evidence-based way of changing your diet, or you need to start an exercise program. You don't need the medication. But when we default to prescription writing, which is much easier to do than to counsel someone, because we're rewarded for transactions and volume of patients, that we process more than we are the dialogue, the education, the patient-doctor relationship. Of course, people think that our incentives is to the prescription is something we are getting benefit from, but that's just completely wrong. Now, are there doctors who are being dazzled by the pharmaceutical industry and getting free lunches and getting trips around the world, or I don't even know what, to like prescribe a designer drug over the tried and true medication that's generic. Sure. But that's not most doctors. Most of us are just kind of like head down trying to get through the day, right?
Well, and actually, I think most of that's illegal now, anyway.
Yeah.
But
yes, right.
when I was a little doctor, we were like free pizza, like anything that was free.
Oh gosh,
I want to flip that conversation back to what we were just talking about, because one of my beefs with the wellness industry is and this leads to what I love about your book, when I said the art of medicine is back. And you just had a Substack, I think today, that I read about, I wrote the prescription and he wouldn't take it. And it was because that prescription symbolized something for him emotionally. Whereas the wellness industry we have an issue with trust with people and doctors. And the wellness industry is undermining what trust is left by saying things like the secret your doctor doesn't want you to know.
Right. They're weaponizing the fact that doctors don't have time to countenance the whole person. And they're weaponizing the fact that our system is broken, and they're meeting an unmet need. What better feeling than as a consumer of healthcare to feel understood, to feel validated? We use this word so too much, like I feel seen, right? But that's what the wellness industry does. It's like, I see you, I know your pain, I understand you can't lose weight despite eating healthy and exercising, and your doctor's shaming you, and I understand why that's appealing, and they're not wrong. It's just that health is not about having all the answers. It's not about having more products. It's not about individuals' responsibility, as a proxy for, medical care. It's about knowing what questions to ask yourself and the questions to ask your doctor. And that's why I wrote this book, is really to take stock of all the information you have in your own body, in your history. Ask yourself the questions your doctor doesn't have time to ask you, because you can do a lot of pre-work, whether it's, sitting on the couch and reading this book and having a little aha moment, like, oh, I didn't think about the fact that, like, my experience with being bullied on the school bus for my weight in middle school has something to do with how I eat now, which has something to do with my blood pressure and my diabetes now. Like, you can do a lot of exploration of your health and your life on your own terms. It's not to say be your own doctor, but if you ask yourself the questions your doctor should be asking you if she had time, and connect the dots between your mental health, your physical health, your diabetes, and your sleep and your stress, you can all of a sudden start connecting dots, and then, ask yourself these questions and ask your doctor smarter, sharper questions.
I wanted to go back to something about like how the wellness industry, and again, to be very clear, there's some really great wellness things that are out there, but there's a lot of charlatans and snake oil. But going back to the TikTokification, that's a new word I just made up. That's a neologism. A TikTokification of like wellness and healthcare, is they also are playing on the fact that as scientists, we are taught to question, we are taught to not have the definitive answer all the time, that we are usually directional, and we do have, like, how long am I going to live? I don't know. It could be X days. It could be X months. How will this medication treat me? These are the general kind of things that could happen. We speak in conditional statements a lot of times, where these wellness folks oftentimes are very definitive. This will do that. It's so certain. And we're kind of a victim of our own kind of scientific thought process, because we are always taught that you never find the definitive answer. Like, you're always working to challenge and move forward. And then they're exploiting that too.
Yeah, that's right.
Well, I mean, look at how many, like, I just was at some like medical conference and I got suckered into buying this. Now I think it's fabulous, but told my husband when I got this laser for my face, because of course I want to, like, who am I to say? The guy who invented the technology worked at NASA. I mean, who am I to say it's not going to do anything? I think it looks good, don't you?
I don't know. We're not endorsing products.
That's right. So I think that the illusion of control, the illusion of certainty, the illusion of someone telling you, like, I know that I see you, I hear you, your doctor's not listening, and if you just looked behind this curtain and bought this product, I can, almost guarantee you results. That's very seductive. I mean, we're human nature. It's behavioral psychology at its best, right? And I don't blame people for thinking that, the supplement is going to help them with their depression, or this vitamin is going to help them with longevity, or that optimizing this body part is going to, help them in every way. But I mean, people are I think we've over evolved in modern society where we are outsourcing. I think we've over evolved in modern society where we run the risk of people being distrustful of their own instincts, right? Like outsourcing their intuition. Do you need an Oura ring to tell you that the third glass of wine made you sleep poorly? Maybe you do, and maybe that's what you need to motivate to not drink as much, and that's great. Like if that is what helps motivate you, or if your step tracker helps you get that extra, steps at the end of the day, that's fantastic. I also see people though who feel like their trackers are, a bad boyfriend, like judging them, shaming them, making them feel bad about themselves, like demanding more, right? So I think that we need to go back to first principles as humans and not be victims of these dueling, these dueling industries. Medicine over here is just transactional and impersonal. Wellness over here, that's aspirational and, certain. And, ask ourselves hard questions, ask ourselves nuanced questions, because your doctor doesn't have time.
Lucy, I want to ask you a hard question, especially sitting
Please.
in Washington, D.C. and considering the political environment that we're kind of in right now. Do you think that the financial structure of our healthcare system, the capitalist nature of volume-based kind of healthcare, is it what's killing our system? Is 100%. That the root of the problem?
Yes. 95% of healthcare spending in the United States goes to damage control, ER visits, hospitalizations, all the administrative tasks. Only 5% of healthcare dollars go to preventative care, primary care. Primary care, which is what I do, was designed to be a hub for problem solving, the medical home, the place where people went to talk about their grief, their heart disease, their cancer screenings, and where trust and rapport between patient and doctor was the bedrock, or is the bedrock, for communicating risk and understanding the whole person. So when you have a system that rewards volumes of patients seen in a day and not the conversation, and you're treating downstream consequences of the lack of conversation, and you just don't prioritize primary care, what happens? Doctors leave the field. Doctors or new graduates coming out of medical schools aren't choosing primary care fields when they see that, they've got $200,000 worth of debt, and they see that you have to see, patients in 10-minute increments, and they're underpaid and overworked. Why would you choose a primary care profession? So primary care in the U.S. has been hollowed out. I don't even think we have a healthcare system in this country. We have a health insurance system. And then people end up in the ER for what a primary care doctor could do. And I think the payment structure is the root cause. It's not doctors being unempathetic or making a buck off of prescribing Lipitor. It's the whole system is geared towards damage control, and it's broken by design. It's not an accident. So I think, we know exactly how to solve this problem, which is to deploy primary care, to distribute primary care, medical homes into communities, practice value-based care. When people are given access to a primary care medical home, or they can go to their primary care doctor for their pneumonia and not end up in the ER, when the primary care doctor knows their name, not just their diagnosis codes, you save money and you save lives. Full stop.
It's what that I think people don't realize, that it's the procedures that make the money, and everything else is just volume, which really makes you, I find it so curious, you're kind of a dying breed. Like, what made you go into primary care, and why are you still in it? And how many private practices are left?
So, primary care is, I think, a dying art. It's not that we aren't taught in medical school humanism in medicine. In fact, that's a big focus in medical school. It's just the system doesn't allow that. It like sort of beats the humanism out of doctoring. So I left the system. I started my own practice in 2024. So I have a smaller panel. It's direct primary care, which I fully acknowledge could be considered part of the problem, and it is. But more and more doctors are taking matters into their own hands and saying, "Look, I can't see an 80-year-old patient who's just been discharged from the hospital with a hip fracture and who just lost her husband and has on 10 minutes and in 15 minutes. You just can't do it. It's moral injury, right? So
yeah,
either I just am miserable and patients are miserable too, or you craft a practice that is designed to help you care for patients the way you want to, the way they want to, the way people deserve to. The next step is to scale models of primary care that do value-based care, that understand the patient, not just their diagnosis codes and their lab test results. And that just needs to happen. And doctors like me, more and more, are leaving the system to do exactly this.
Yeah, I so similar to you, I'm an ER doctor by training, and I got frustrated with the band-aiding of like healthcare completely. Now, granted, in the ER, we are not individually, in most cases, paid by every single person that we see. It's more indirect than that, and many times they're salaried or paid by the hour. But it's still like we only get a certain amount of pay if a certain amount of patients are actually walking in the door. And so, you're dealing with complex things with, 7 and 8 minute increments. I think my average time with patients sometimes are less than 8 minutes. And, you end up seeing 2 patients an hour. You're like, well, that doesn't make sense. No, there's a ton of administrative work and things are doing in the background. The point is that like yourself, I boarded in lifestyle medicine to start looking at ways of preventing and treating through lifestyle changes, but you know what the problem is, Lucy? There's no real payment mechanisms for those. There's no real reimbursement mechanisms for that. Like, I can't go and be like, okay, Adam Brown, MD, doctor, going to set up a clinic in Washington, D.C. and leverage the current existing Medicare and insurance system to open a clinic that will pay the debt of the clinic, pay the staff of the clinic, keep the lights on, and see patients. There has to be other mechanisms that we're having to explore as doctors, because the system is not allowing us to spend the time with those patients and do the things that we need to.
I think there's hope, though. I mean, if we want to talk about AI, like I'm highly suspicious of the tech industry, the tech world, but we have to understand that it's already here in medicine. It's already here in healthcare. Like, I use AI every day to help draft summary letters to my patients, particularly after complex visits, to make sure they have a printout. Like, I'll dictate something and then it gets nicely transcribed. I use it to draft letters to insurance companies to argue with them about why they won't cover my patients' medications. I use it for administrative tasks. AI is already here in healthcare. It's coming for us. And I think if doctors don't shepherd AI, like in a policy way, if we don't help AI do the things that it could do to then elevate and not eliminate the patient-doctor relationship, we're in big trouble. But if we use AI and point it at the grunt work, the administrative burdens, the bottlenecks that keep doctors from looking at the patient and instead looking at the screen, if we point it at those things, like even just having a shared care plan or like an EMR that's integrated so that your ER visit, your cardiologist, your kidney doctor, and your primary care doctor all are seeing the same data, and it's curated by the primary care medical home. Like, that is a no-brainer, right? Like, you have a digital avatar of yourself in every different, place you've been as a patient, and to bring that all together alone, that would be a success of the AI, addition to medical care. But I think if we let Silicon Valley reinvent healthcare without doctors guiding it, we run the risk of just having more efficient, shitty systems, right? Like,
exactly,
faster transactions.
The sewage pipe runs faster. It doesn't clean up.
The sewage pipe runs faster. Well, and that's back to what we were saying before, which is in your book, it's about personal values and what you want and what your goals are and what is affecting your ability to achieve those goals, but the doctor is still guiding the evidence, decision making, that kind of
Right.
thing. It has to be physician led rather than, I'm going to sneeze.
That is a hilarious sneeze.
So
It
I'm
is.
now at an
I'm
age
trying
where
to
I have to stop walking and hold on to the wall when I
Yeah, I do
sneeze
too.
because my
Yeah.
back goes. Like,
Mm.
I don't want to be old like this, which is bringing me to, I guess, now that I know that you have a grown son who's very handsome. He's been leading a lot of your PR stuff on
Yes,
this.
I
So
have two
we've
grown
got to be
sons.
around the same age. Adam and I talk a lot to ourselves about what a misery it is getting older. And now suddenly I'm the patient, right? And I'm in the hospital and I'm having my hysterectomy and I'm having to say thank you to the nurse. And I'm having to tell the 12-year-old internist who just came in to see me to go away because he doesn't know what he's doing. The nurse and I will sort me out, right? What has your journey been like as you grow older and you find yourself on both sides of
Well, first
the
of all, I'm
bed
the
pan?
worst patient alive. Like, I am terrible. I wrote about in my Substack, Are You Okay? I wrote about my own ridiculous sort of approach to my health. Like a year ago, I had this neck pain and I did what people do. I'm like, oh, it's just, I'll just ignore it. I'll take a fistful of Advil and it'll be fine. But like fistfuls of Advil over a couple days becomes a stomach ache, becomes like, what's going on? Oh, wait a minute. I think I'm taking too much Advil. Okay, that's the problem. And then I do what people do is I go online and I look at these gizmos on Amazon. They're so cute. They're all these beautiful colors. And it's like, the massager that like is going to take away your pain. The little gizmo that, unlocks your jaw. And I buy all these little gizmos and then of course nothing's happening. And then I decide maybe I should see a doctor. Maybe I should actually see a doctor. So I go to my friend who's a spine specialist and he's like, you need an MRI. I'm like, that's crazy. An MRI? That's like just ridiculous. He's like, you're objectively weak in your arm. I was objectively weak. So I had spinal cord compression from a disc and I was weak in my left arm. And I hadn't even realized it. Anyway, so, sometimes we are our own best self-advocates. Sometimes we are our own worst enemies. But that's not my whole journey in being in medicine. I mean, I have 3 children. I trained at Harvard and Hopkins, as you know. I quickly realized that medicine, while wonderful and beautifully able to treat disease, is not great at treating the whole person. That's what I wanted to do, and then build a practice ultimately that is centered on evidence-based, patient-centered care. And then write a book to help people beyond the walls of my office make sense of their own bodies and minds and make sense of the system and become a more empowered patient and an agent of change. Because one empowered patient at a time becomes a movement to transform healthcare in this country, to center primary care, to provide unfettered access for everyone to a primary care medical home where the relationship is the commodity, the conversation is the treatment. And everything else springs from that.
I know we've only got like a couple minutes, but one comment, and then my last question to you. The comment is, I think people forget, and doctors are very good at forgetting this too, that we are actually humans. Like, meaning that, we receive information. We don't all just receive information from JAMA and a New England Journal. Like, this is something I have conversations with on the marketing side of the job that
because
I do.
I also read People magazine.
Yeah, MedTech. So like, we've got to have something in New England Journal. I'm like, okay, great, but you do know that we look at TikTok too. Like, I mean, like that doctors do that. But anyway, I love the commentary about the humility about like, hey, I'm a human and I realize that like I'm not a great patient and I have to do this, that, and the other. And I think, the more doctors kind of put themselves in the patient shoes too, because there's patients that are in denial, that I can't have. My dad has smoked and has heart disease. I don't, because I'm a runner. That kind of mentality is really important. So anyway, I love those comments. My last question to you is what we usually ask about, like, I think we can assume that we believe that the healthcare system is unstable in the United States and actually in the UK where we are now and other places too. But is it so stable that it's unfixable?
I think that the problem with trying to fix the healthcare system is that we're doing sort of like patchwork, piecemeal help, right? In the federal government, it's so slow. It's incrementalism, and that's fine. It's just that it's not going to do the like radical change we need. If we're going to flip a financial model, a payment system where, we change from 95% of healthcare spending goes to damage control, 5% to prevention, and we're going to flip that on its head, that's going to take radical transformation. So I think that the pieces are there. Like, doctors want a doctor. Patients need doctors. Medical evidence abounds. Like, we don't need more 3D printed, hearts. I mean, sorry, I shouldn't say that. No offense to people who need a new heart. I'm just saying we almost don't need any more technology or medical evidence. We just need people to be connected to, have access to primary care. So all the pieces are there, and all the medical economics data are there to show what needs to be done. So I think what's going to happen, if it's going to be done well, is that it'll happen in the private sector. Whether you like that or not, you can have an opinion about that. I don't think it's going to happen in the government, just because there's too much political risk for anyone on either side of the aisle to make a wholesale, like, radical change like that. And innovation and technology are where, transformative change are happening in the modern era. And so I think that's where it will happen. But I do worry about tech alone coming for healthcare. If tech partners with medicine, tech partners with doctors who understand what primary care is, what, how foundational the human elements of care are, and you keep the humanism as the foundation and the tech as the sort of wind beneath our wings, so to speak, then we're cooking with gas.
Mm-hmm. Really great comments there. Lara, you finish this up?
Well, I'm going to say thank you to Substack for helping me find Lucy, and a huge thank you to Lucy for allowing me to pre-read the book. I got to be part of that team. Woohoo! And I'm going to say that I really did enjoy it. I think it is an excellent addition to the library at Barnes & Noble or wherever you get your books these days. And I'm thrilled that we got to finally meet in person and have you on
Absolutely.
So busy running around promoting this book that just came out like this week.
It just came out this week. The book was on the Times Square, the NASDAQ tower. I got to go on Morning Joe yesterday and CNN and NPR later today. So it's just bananas, but it's been super fun to spread sort of hope about what you can do to be a more empowered patient and to spread the word about what kind of change is possible.
Well, thank you so much.
Thank you guys so much for having me. It's been a delight.
Well, this has been great. And with that, we're going to wrap up yet another episode of Unstable Vitals. You'll be seeing us back here soon, talking to somebody else who's smarter than us, likely.
That doesn't take much. That's not too much.
Really, bar is so low.
I know. Thank you, Lucy. So good to see you. And best of luck with your book.
Thank you guys so much. I really appreciate you chatting with me.
Thanks for tuning into Unstable Vitals. If you enjoyed this episode, make sure to follow us for more unfiltered conversations on the pulse of healthcare. Connect with us on LinkedIn or visit us on unstablevitals.com to stay in the loop.